Hey everyone, good afternoon. This is County Executive Pat Ryan. Thank you for taking time out of your day to join us for the COVID update. This is, I think, a particularly important one given what's happening right now and also what we're headed into with Thanksgiving and the beginning of the holiday season. So I appreciate everyone joining us. We are going to, I'm going to take some time to answer questions as well. Which I know we haven't done in a little while. So if you're tuning in and you have questions, please post those in the comments, and my team's going to be watching that and try to get as many of them as they can to me. We won't be able to get to every question, but if there are some major ones popping up, we'll do our best in this session and continue to try to do that as the situation is changing and developing. You know, at the high level, unfortunately, continued bad news in that we're seeing a now increasingly sharp and sustained surge of COVID across the county. We'll talk about the numbers leading us increasingly to that conclusion. But as I've said now for the last several weeks, we've seen this coming, we've seen this building, and I am concerned that while most people are taking that seriously and taking the precautions, clearly not enough of them are, enough of us are, because we are very much seeing the numbers surge in a sustained way. Cumulatively, looking by the numbers, we are now well over 3,000 total cases since the beginning of COVID, 3,149 to be exact. We've tested 147,000, 147,476 to be exact total tested, with 2,394 recovered. And unfortunately, since our last update, we have had another fatality in the county, both reminding us of the seriousness of COVID and bringing us just shy of reaching triple digits in terms of the number of our residents who we've lost to COVID already. And I think now it's very clear in looking at the numbers and speaking with our health experts that if we don't radically change the trajectory here, we're going to really, heading into the winter, see all of these numbers go up, including that worst indicator of fatalities. So please share that urgency and spread that urgency, because it's going to take every single one of us working to get this back under control. In terms of our hospitalization numbers, we are actually, this is the one small point of positive news. We've seen our hospital numbers come slightly down from where they were last week. We're now at 9 total hospitalized, with 1 in the ICU. That is, of course, good news. But as we saw in the first wave of this, as the total cases go up, as the hospitalizations tend to follow, and then tragically the deaths and fatalities tend to follow after that. So if we can't get that first number of total cases across the county under control, we unfortunately know what the consequences are. Active cases, this is one of the indicators that our sort of worst case projections we're now starting to see bear out in the last few days. You can see it very starkly on this graph, where we're now at 656 active cases in the county, and you can really now see the steep incline, the steep slope of that growth. It's pretty close to where we were at the beginning of this in mid-March and late March. And we all know, again, where that leads. One caveat here that I do think is important: as we've added rapid testing capacity, what we call point of care, POC tests, meaning not the diagnostic tests that we've been doing, but as we've now added our rapid tests, we are counting those results as well in this number. Part of the reason then that we're seeing that number go up is that we've added just this week started counting these rapid tests in our results. They are still very much positive. So these are absolutely individuals that are positive. But in order to make sure our numbers at the county were aligned with the state, who does also report these point of care tests, we're counting those in now, and we had not been counting those up to this week. So that's just a little bit in the weeds, but to make sure that we're being that we're sharing how those numbers are changing. Regardless of the means of testing, what is most important, though, is that just last week, we had barely reached the 500 active case threshold, and now in just a matter of days, we're rapidly approaching 700. And so that gets to be at that closer and closer to that exponential spread level and beginning to indicate possible community spread. And that's what we've been working to avoid. So you'll hear me in the second half of this talk about what we can do to get this back under control, but the urgency to do that is growing and growing here. Another data-driven view of where we're at, of course, is the number of new positive cases. Throughout the summer and into early fall, we were doing really, really well here. We were doing all the things required in terms of reopening and at the individual level, and we were keeping this rate of new infections under 1% for months. So we know that we were able to do that. What we're now seeing in this data, as we've seen across the rest of the state, is us getting back up to very concerning levels. So where are we at right now? Over a 96-hour period, so the last 4 days, we have tested 4,355, 4,355, and had 132 positive cases. So that over a 4-day average, that puts us at just over 3% new infection rate, 3.03%. More concerning, though, is that in the last 24 hours, we've had 56 positive cases out of 1,100 tested, putting us at 4.9% new infection rate. Last week we had a day where we were at 7. Now we've got a 24-hour period where we're just under 5, and we're seeing that average, that rolling average, really start to tick up. This begins to put us in the category where, like many of our neighboring counties and towns, we approach reaching that state-designated level of the yellow zone designation. I'll talk a little bit about what exactly gets us there, but in short, multiple days of being above 3% new infection is really the trigger that brings us into that yellow zone, and we are now at that point. And so if we continue on the trend, even if it doesn't get worse, we are headed towards that yellow zone designation. And if things continue to get worse, of course, the restrictions could be even greater. That is the last thing that any of us want for our schools, for our businesses, and just for us to go about our lives. So the window to affect this is narrowing and narrowing and narrowing, but it is still there. And there are still opportunities, especially with Thanksgiving in 2 days, to change the course of this trajectory. And that's really what I'm asking each of you to do and to encourage others to do. This projection graph, which we started adding back in last week, really gives you another view of the severity here. And you can see best case, middle case, and worst case, and really the slope of that line. In the worst case, that blue dashed line by our projections, that would put us at an even steeper rate of growth than at the peak of this in the spring. And what's increasingly clear from the numbers is that if we don't change what we're doing now, this second wave is shaping up to be worse than the first wave. I want to repeat that again. It's almost unimaginable, but the second wave right now, based on what we're seeing and the laissez-faire attitude of a certain number of people that's spreading it, it is shaping up to be worse than the first wave, which is extremely concerning given how taxed all of our healthcare systems were and how detrimental, of course, the first wave was to us. Hospital and treatment capacity, we are in good shape here, currently at 9 with 1 in the ICU and more than sufficient need. I have been speaking regularly with all of our hospital leaders. They are doing a great job them and, of course, their great staffs, both dealing with the current situation, but also readying themselves again if needed, making sure that their PPE and other supplies are ready, that their staffing plans are ready, that they have all the latest best practices in treatment from around the country. As we've gotten smarter and more informed medically about the disease and how to deal with it, or excuse me, the virus, we have all that knowledge being incorporated by our great healthcare professionals here. And so that is some also reason for optimism in the midst of some of the concerning data. Again, I know I'm hammering this here, but this is a wake-up call and has to continue to be a wake-up call moment for us. The 4.9% positivity rate last 24 hours, now over 650 active cases and 9 hospitalizations. We're now well into the territory where you can see it on all those graphs and indicators. We're back where we were at some very challenging and tough times in the beginning of this. And I know for me, it's sort of bringing back those memories, which we've all tried to forget, of how strained things were, how difficult things were, how tragic and really deadly and heartbreaking things were. And so that is again a call to action. What are we doing? Continuing to do all the pieces we've talked about in terms of rapid response and individual actions. One of the biggest pain points we've been hearing about, and I'm not seeing the comments now, but my guess is will be some of the questions we'll get, is about testing, our diagnostic testing and our rapid testing. We have maintained throughout all the sort of ups and downs of COVID significant, robust testing capacity where we can do anywhere between 500 up to 1,000 to 2,000 tests a day. What we've seen, though, leading up to Thanksgiving, is I think both people are concerned about the rising cases, but also potentially wanting to see loved ones. We've had a huge rush of people to our testing sites across the county. And frankly, we do not have the capacity to test everyone in the county at one time. That is not a situation that anywhere in the country is set up for, unfortunately, going back to the very beginnings of the federal response. We can maintain the critical testing that we need to keep this in check and give us a sense of what's happening and protect those at greatest risk. But we can't be in a situation where every single person, 180,000 plus of us in the county, decide, well, I want to see my family member for Thanksgiving, so I need to go get a test. That, unfortunately, does not work, and that's some of what we've been experiencing. I know that that's frustrating for a lot of people who would like to have a test, but it's also been very detrimental for folks who need to have a test, because we've created a situation in the last week to 10 days where we have had folks who need tests that aren't able to get them. And so we are responding to that. We are upping our testing capacity. In the immediate term, Health Alliance, and I really want to thank them for this. I was on the phone with Dr. Doyle yesterday. They have added hours to their testing site, the Grand Street testing site in Midtown Kingston. I've asked them also, and they're looking at whether they can expand this further, as we've also asked our other hospitals and testing partners. We've got another meeting with them next week to see how we can ramp up our testing. So we are hearing the concerns about needing more testing. We're moving as quickly as we can with the limits that we have at the state and federal level with both staff and equipment and everything else. But I do ask everyone to try to understand that we need to try to prioritize these as best we can, but also know that we're working to add more testing capacity. The other thing that I do want to remind people, one of the points and questions we've been getting is about setting up appointments and how to actually get a test. So a few points there. Number one, our county website, our Ulster County COVID-19 website, has the detailed information about our various testing sites, what their hours are and what their protocols are. That's at covid19.ulstercountiny.gov, where you can just Google it and you'll find it there. The other thing, though, there's been a little bit of confusion at the Grand Street testing site. When they are open, you can also walk in. That is a site that will accept walk-ins as well. So if you're not able to get an appointment, you can also try to do walk-in there. But also, again, remind people that trying to preserve the capacity that we do have for those that have greatest need. I know that's not ideal, but that is where we're at with testing right now, given those constraints. The other pieces that we're continuing to implement and run in response to the increasing COVID situation, of course, our rapid response plan overall throughout the county remains in place. We are still very much using the tests we're doing to find any burgeoning or emerging clusters, to quickly contact trace them and to try to contain them. That gets harder and harder as we have more cases and you start to see the sort of web of people's contacts intersecting with each other. And as we begin to possibly approach a community spread situation, that gets harder and harder. But we will continue to do that work throughout to try to blunt the effects. We ask everyone's cooperation with that contact tracing as we do it, and we've had pretty good cooperation with that, so we appreciate that. We're continuing to work with our schools, and I think we'll probably talk about that in the questions, the Q&A. But our schools are actually doing really well, and the infection rates in our schools are much lower than in the general public. So I want to thank all of our educators, teachers, and staff that are making that part of this work. But we have our school rapid response plan in place. We have our limited, but we have rapid testing capacity that we are surging out as we have these different clusters, and that's why you're seeing those point of care test results come in. So we're doing everything that we can at the county government level, at the town municipal level, and across our businesses. But I ask everyone to continue to take this seriously and do what you can individually and as part of your family unit and your workplace or your other sort of social groups to spread the word to take this seriously. As we wrap this up and move to questions, but I want to just hit on one other point, which is, of course, the timing of at least my personal favorite holiday, Thanksgiving, and I know for many others, one of your favorite holidays. The timing couldn't be worse, frankly, for this year, where here in Ulster County and across the state, that really coincides with a major surge, as we've just talked about. And you know, I know there's been official guidance with numbers and so on and restrictions put out, but what I really think, and the message that I want to share with everyone, is that it's not about restricting, it's about us choosing to do the right things. And to help us frame that, I want to talk about what's happening nationally and what's happening around homes and Thanksgiving tables across the country. So right now, we're going to put up a graph of hospitalizations in the United States. Right now, we have 86,000 plus people today in the hospital due to COVID, and those numbers are rising in the state and in our area. 86,000 people who won't be able to be with their family at Thanksgiving because they're in the hospital. We've got well over 250,000 individuals whose lives have been lost, and that means millions of Americans on Thursday will have an open seat at their Thanksgiving table because they lost someone tragically to COVID. That is the perspective that we have to have, unfortunately, and I know that that's hard to hear, and it's sad, but that is the truth, and I think it's important for us to really understand and internalize that as we make our own last-minute decisions here about our plans individually and for our family. I'd really ask, we know, I trust that we're all smart and we understand how this works at this point. We know what we should and shouldn't do. We know how this is spread, and we know who we put at risk by getting together in big groups, as hard as that might be. So please think about that as you're making your final Thanksgiving plans. And please don't be afraid to change those plans based on what's happening here and what's happening nationally. The decisions that we make in the next few days here in the county, in our homes, and across the country definitively are going to mean the difference between folks' lives right here in our community. So please keep that in mind as you're making your holiday plans. Please continue to, when you're out and about and when you're meeting with folks, wear masks, maintain social distancing, and wash hands. Please continue to thank and appreciate and recognize all of our frontline workers who have gotten us through this. That is the one opportunity we do have on Thanksgiving, is to especially thank those who've put it on the line for us and are doing that again now. I'm going to take a few questions here, and bear with me as I pull up. I'm getting questions sent to me, so let me pull these up here. Okay. So I'm going to try my best to get to as many as I can. Question from Liz: when will rapid testing be available to the general population in Ulster County? It's a great question. We're hearing that over and over. I am doing everything I can to advocate and push to get more rapid testing. The real limit is that there's just not a lot of these available in the commercial markets, and definitely not a lot coming from the state. So we've been fighting to get as many as we can, and we've had small numbers and have had to really focus them on those higher risk facilities. I can't, unfortunately, give you an exact date or answer on that. I know several of the pharmaceutical companies are working as quickly as they can to get basically tests out that you could use at home yourself. The one caveat on these tests is they are not as reliable and effective as the full-on PCR diagnostic tests. And so that is an important caveat for all of us to just keep in mind, but it is better than nothing. So I wish I could say that it's going to be in a week or a few days, or even just to say I know for sure. But right now we don't know definitively, but know that we are pushing, and everyone's pushing, to get the rapid testing widely available as soon as possible. Another question from Paul. At what percentage of infection are schools going to move to remote learning? Is it individually based on what the school district feels is safe? Has Ulster County and the county government set a number? Thank you. Thank you, Paul. This is another one that I know we're getting a lot of questions about, which are our schools. So a few part answer to your few part question, Paul. Number one, the state and the governor have set it such that each school district is making the decision, but it's being done in consultation with our health department and the state health department. And so we're in daily contact with all of our school districts. Each of them are weighing this and wrestling with this now. I know that for sure. There is no, I know New York City has set a particular infection rate number. There is no number that's been set in the county or more broadly. That's a definitive line. What I will say about this is, as I alluded to earlier, the schools have done a great job at actually controlling COVID spread much better than the general population has. We're seeing infection rates somewhere around 0.1 to 0.2% within schools of actual cases, compared to 3, 4, 5% that we're seeing outside the schools. So I know the initial worry was that the schools would be a vector to spread it out, but in fact what we've seen is that the community has been coming, the cases from the community have been coming in and disrupting school operations when either a teacher or a student or a bus driver or another staff member has gotten COVID. So I think if anything will force the schools to switch to remote, it would actually be that the wider community spread is impacting the ability to have teachers and staff to actually continue to teach in person. So myself and our health commissioner and all the school superintendents actually sent a letter to all the parents this week saying we want to do everything we can to safely keep schools going, because we have seen the infection rates in the schools low, and that it's actually going to be impacted more by what the broader community does. So many parents that are wanting to keep kids in school and do it safely, the best thing you can do is follow the precautions. But to make sure that we protect our students and our teachers, we will continue to look at that closely, and our health commissioner will have that dialogue with the school leaders as they really wrestle with that. Again, it's a little bit of a, we're going to take it as we go and really let the data and the situation drive the decision. Another question from Jason. Are there any single, quote, hotspot locations causing the county increase? Great question, Jason. The short answer is no. There's not one single point or even a single town or a single cluster that's driving this. What we've now reached is a point where what we think happened is a big driver is that folks got together during Halloween, had small gatherings, and cases spread there. Those results started to show 2 or 3 weeks later, which we started to see last week. And then the second and third order effects of that has now created a ripple effect that's really causing a spike. Obviously, that sets us up for a situation where if we repeat that from a much worse point now, starting going into Thanksgiving, it could really get the situation with widespread community spread to an uncontrollable place again, which we cannot have. So the short answer is every single household and every single person really could make or break the difference here, and there's no single easy answer, unfortunately, where we could just contain it in one place. So that's where we're at right now with that question. And I appreciate the question, Jason. If that changes, we'll let folks know. But this is kind of the living room spread that we talked a lot about in the last few weeks, and the sort of casual spread that we're seeing pick up steam. Another question from Christine. Who are the unknowns on the municipality list on the dashboard? Good question. So oftentimes, due to a glitch in the lab, when labs do tests, they report those results, but sometimes data gets missed or an address is not entered in some cases. So often we get an unknown location, but we know there's a positive case somewhere in the county. So we want to count that, but not attribute it yet until we can do the investigation to place that. So that's really what that unknown means. It's a sort of a bad data coming in kind of a problem, which we have to constantly work to improve. So that's where that is coming from. Another question that we're getting, a few different kind of themes, all asking about are further restrictions coming, and what will further restrictions look like? So I want to just take a second, and all this is on the New York State website if you want to dive in yourself. But as we've been experiencing the second wave, the state has put out this 3-phased framework for restrictions, trying to be much more targeted so that we're not having these broad across the board closures that harm our economy as much as we saw in the beginning, but still keep COVID in check. So there's yellow, orange, and red zones. Basically, the closer you get to red, the more restrictive those zones are. And there are different criteria set largely tied to the same metrics that we talk about in my daily briefs, that would move us into that category. So particularly to our south in Westchester County and Orange County and Rockland County, we've seen either multiple towns or single towns or cities move into these yellow zones, including a few just over the weekend in Orange County to our south. And what that basically means is There are restrictions on a few different things in terms of businesses and indoor dining. There are testing requirements for schools. And in general, there are, in an attempt to be much more targeted, restrictions on the highest risk points, which often orients around indoor gatherings, indoor dining, situations where larger groups of people are together indoors without masks. So if we continue on the trend that we're on, we absolutely are, as I said earlier, headed towards that first step, that yellow zone, which will mean some restrictions on gatherings, restrictions on indoor dining, increased testing requirements for our schools, and in general, a bunch of things that we've been through that we know are both tough mentally and psychologically, but also very much tough for our businesses and our young people and really all of us. So again, we're not there yet, but if we don't drastically turn around the situation and start flattening that steep spike, we will see us headed for those yellow zones. So I tried to get, are there any other big topics? I know I want to try to keep, be respectful of everybody's time, at least get to as many questions as we could. So we'll continue to answer as many of these as we can. Please keep them coming. Also, if you have specific issues or challenges or questions, anything related to COVID, anything related to other needs, especially as we head into the holidays around food, a shelter, a warm place to be, please know that our Recovery Service Center team is available to help. You can call at this number, 845-443-8888, or you can go to the website as well, and we can direct you to wherever those needs may be. So I know that was rapid fire to get through, and I appreciate everybody tuning in. Again, I appreciate what you all are doing, especially as those tuning in. I know you're doing the right things. You're asking the questions. You're making those smart decisions. Please reach out to others in your life and encourage them to do the same. As we remember from the beginning of this, the decisions that each of us make not only affect our family and our loved ones and ourselves, but directly affect vulnerable members of the community, directly affect our frontline workers who have to go to work, our healthcare workers, our delivery workers, our food workers, so many others who have no choice but to keep working. Any decisions we make will affect them and potentially in a very serious way. So going into Thursday, please keep that all in mind. I know how hard this has been. I know the pressure on all of us is just immense, and we were hoping that we were through this. And believe me, I was so much. I'm with you all on that. But at this point, we can't ignore what's happening here, and that means that we have to change our behavior. So thank you in advance for doing that. I hope that to the degree possible, you can have a restful and reflective and healthy and safe, more than anything, Thanksgiving. I know we're going to be getting creative with how we do it in our household, and I'm sure everyone out there is working through that. So after Thanksgiving, maybe we can all compare notes about how we made Thanksgiving work 2020 style. I'm sure none of us will forget this anytime soon. So in the meantime, be safe, be healthy, stay resilient, and we will not be doing an update on Thanksgiving Day. So we will see you again in a week, and I hope that at that point we can have all taken these actions and we'll start to see that in the numbers, and we will see you then. Thanks.